Hello and welcome. Today we're going to be talking about Chapter 8, Health and Illness in Modern Healthcare. To really understand this, we're going to have to delve into bureaucracies. Really, how do systems function? So, to start, we have to think about society and how it has evolved over time. Society started out pretty much agrarian, hunter-gatherers, then a little bit agriculture, but then over time, especially since around the Industrial Revolution, you started to see society become more formal, more rational, and this is something the book talks about how the healthcare system is rational. And as society became more formal, more rational, then it became bureaucratic. It became guided by a set of rules, expectations, policies, an infrastructure, all developed around structuring society. One aspect of the social bureaucracy is healthcare. Healthcare is a bureaucratized system. This means it's a formal, rational system that is follows a set of rules, regulations, laws. It is a combination of the work of individuals working together to build a system. So again, the healthcare system evolved over time. You had your original doctors going around on horseback, to the medicine people, and then all the way back to the ancient cultures. But then since the Industrial Revolution and really the 1700s, 1800s, as we started to gain knowledge about anatomy and the body, and science became a thing, and you start to see this whole development of the bureaucracy around medicine itself. So healthcare is a system, okay? Otherwise, you can call it a bureaucracy. It's a formal, rational system, which is pretty much how you define a bureaucracy, okay? As things become more bureaucratic, you do tend to have problems, such as groupthink and things along those lines. However, you can definitely see that as technology has increased and as the bureaucracy of healthcare has increased, the lifespan of people has increased, the mortality rate of babies has decreased. So, yes, there are many critiques to having a bureaucratized formal system. However, you can definitely see where the formal healthcare system that we have in the United States is pretty effective, and we are saving lives compared to how things used to be back in the day. I mean, for again, women, 1 in 5 would generally die in childbirth back in the day, for example. And that rate in America is only down to, is much lower than it used to be, for example. So the modern healthcare system. Again, to understand the modern healthcare system, we have to figure out how it became the modern healthcare system, which means tracing the history and evolution of the healthcare system. So again, it started out more in tribal or herbs, things along those lines. Then as we began to get more knowledge about anatomy and science, you definitely start to see the development of medicine and doctors and surgery. And then by the Civil War, you're starting to see some remarkable things going on. But after that, that's when we start to get really formal with our science and we start to develop this modern healthcare system that we have today. So, again, the bureaucracy of the healthcare system, the investment of the country, the investment of our gross domestic product toward the healthcare system, establishing rules and regulations and medical boards and oversight committees and the hospital system. Guys, the entire system, that's the bureaucracy, okay? This evolved over time as people got together, interacted, and built the system. Okay, we had to write the policies and the procedures. Okay, we had to come up with the ethical guidelines. Then we had to impose a standard, that makes sure everybody follows all these procedures. Then there's the training and the medical schools and the college involvement. Then there's the research side and the billing side. And again, the healthcare system is massive. It's a massive system of interrelated parts all working together to contribute to the whole. And again, if you want to look at all the departments within a hospital, it's going to take an entire page just to cover the departments in a hospital. Okay? So again, healthcare comes out. The idea of even somebody becoming a doctor comes out once we start to get freed up from the farms. Because to be a doctor, to acquire that kind of specialization requires an economic surplus. So as society got more and more surplus over thousands and thousands of years, people began to specialize more and more into these fields. And in modern times, you have the ability to specialize as a doctor, which gets you your money to pay for your food, essentially. So, doctors, medicine, this field again comes out of this specialization, the division of labor. The division of labor comes out of an economic surplus. So, arguably, the reason we have a formal bureaucracy in modern times is because there was a surplus. People began to specialize in the jobs they began to pursue. We developed a whole bunch of research knowledge. And then we started to put all of that into action, and we eventually built what we have today of the modern healthcare system. But guys, 100 years ago, it didn't look anything like it does today. It was not as formal, it was not as bureaucratized, it wasn't supported like it is by the government. This took a long time, okay? And the biggest thing that also came along was the history of technological change, that advancement of society, that gaining knowledge and being able to apply that knowledge to real world problems, such as helping people live longer, treating illness, how to support health, things along those lines. Okay? So, we also need to look at the healthcare system in two ways: one of the prevention of disease, and two of the treatment of disease. So, the culture of healthcare, all of you guys right now are being socialized into the culture of healthcare. Okay, you are learning the common way of life that people in the healthcare live. You are learning the attitudes, beliefs, and behaviors. You are learning, where the culture clashes are, is it between the doctors and the nurses? You're looking at the philosophy of medicine and how you have culture clash when it comes to the philosophy of medicine, like Eastern versus West. Does that hold up still in modern times? But again, what are the attributes of healthcare culture? This means, what is it you guys are being exposed to today? When you look around you and you look at the culture you're being exposed to, this includes the clothes you're wearing, the way you spend your time, how you think, what you care about. All of these factors go into the culture of healthcare, the information you're receiving, how you're told to do your job, etc. You need to be thinking about all of these things. But again, I worked in restaurants for years before I could become a professor, and I definitely absorbed the restaurant culture. I understand that we all work late at night. Our days off are Mondays and Tuesdays. We all eat at 10 o'clock at night after a long shift. We do have that culture of food and wine and dining and, definitely all of that. You have the cooks versus the servers, which as a manager, I was always like, no, everyone get along. Stop fighting amongst yourselves. Everyone, if someone asks for something, you do that. But we all have that culture we're exposed to. So, but healthcare is very distinctive than restaurant culture. Or now I'm in academic culture. And so now I'm absorbing academic culture and learning what that's all about. But for you guys, it's learning about healthcare culture. I get exposed to it a lot just because I'm a professor at a nursing school, which is amazing because now I'm totally exposed to the healthcare culture, which is absolutely fascinating to me. But for you guys, culture is a common way of life. So the healthcare culture is a common way of life shared by healthcare employees, healthcare workers, whatever your preferred term is. All of you guys are being socialized into that way of life. And with that comes language. Like in working in hotels, you have words like RevPAR. And in healthcare, you guys are going to have all your own abbreviations. I don't know what your abbreviations are because, again, I'm a college professor of sociology and psychology. I don't have the abbreviations for healthcare, but you guys are going to learn the language because you're learning the culture of healthcare. I will never wear scrubs in my life, ever. But chances are, if you guys are in nursing school, you're wearing scrubs. You know what I mean? So again, what's the healthcare culture? Be thinking about what your culture is that you're being socialized into. Healthcare costs are where we start to get into these big disparities between people, okay? Because again, life is not fair and life is not not equitable. Not all people have a fair shot at rising up the social class ladder, and not all people are socially located in the same place in the social hierarchy that is our stratified economic system. Okay? Some people are on the bottom, some people are in the middle, some people are on the top. Where you are located to compare to other people is based upon your access to education, a good job, wealth, power over your own lives, then those other forms of status based upon group identity, such as race and ethnicity, religion. Because your race, for example, your sex, for example, is associated with whether or not you're going to experience prejudice and discrimination. So, therefore, people that experience prejudice and discrimination don't have the ability to rise up the social class ladder, as well as other people that don't experience the prejudice and discrimination. Therefore, healthcare cost is often based upon who it is that you're talking about, because some people can afford healthcare costs and some can't. But essentially, healthcare is incredibly expensive. It's been increasing over time. It's become a $5 trillion per year industry. And your access to it and whether or not you can work in it and where you work in it, again, is associated with all these sociocultural variables. Okay? Why do we pay for healthcare? Because that's an American culture. In other countries, their attitudes toward healthcare is different than in the United States because their culture might be different. But in American culture, we don't have the attitude that, the society should pay for it. We currently are running on the trend that people should be able to pay for it themselves. Now, whether or not this is good or bad, that's the conversation we should be having. Should we have more socialized healthcare? Should we be helping people in minority status be able to rise up and be able to get healthcare just like everybody else? Okay? So again, the problems, we have the quality of care, we have the price of care, and then the bureaucracy itself. It's very hard to be able to work through that entire system. Example, finding a COVID vaccination in modern times for somebody who's 90 years old, that might be problematic for them, for example. So you need to be thinking about all these factors when it comes to healthcare costs. It's how much does it run the bureaucracy? How much can people afford to pay? Who should pay for it? And then we got to be looking at aspects like quality of care. Do some people get better quality of care? Is healthcare covered by some people's jobs and not by others? Why is healthcare cost increasing? Is there a way we can lower healthcare costs? And then again, the entire bureaucracy, the formal system. Does the system itself work? Is the system failing people? Should we update the system, make changes? These are all the things we should be thinking about. Okay? So again, when it comes to access and barriers to healthcare, being able to get healthcare, for example, it's the math equation of your education, being able to get a job, being able to get wealth. These are associated with getting out of poverty because those who are in poverty don't have as much access to healthcare. One, because of the cost, but also does their job cover it for all of those reasons? Okay. You need to be looking at areas like gender and biological sex. Are women more likely to be in poverty and why? And then if women are more likely to be in poverty, how does that associated with their access to healthcare? We need to be looking at minority status when it comes to sexual groups because people that identify as homosexual, for example, often have major issues when it comes to this because of prejudice and discrimination is stopping them from being able to work up the social class ladder, such as getting a good job and things along those lines. Your geography is associated with it. Hence, where you are located in the system of the world, what country you grew up in, do they have a formal organized healthcare system? All of these factors are associated with whether or not you'll have access to healthcare. We need to be looking at the insurance system, which is an extension of the healthcare system. And how does access to insurance affect different people's access to health and illness? We need to be looking at language barriers. We need to be thinking about people that don't speak the common language of the country they're in, for example. Is that associated with whether or not they can communicate their needs and be able to get access to healthcare? We need to be looking at philosophy toward health and illness. And then again, we need to be looking at things like racism and how that is associated with prejudice and discrimination, and how that's associated with keeping groups of people down, blocking their access to being able to rise up the social class ladder. And so if you can't rise up the social class ladder, then you're going to struggle to be able to have enough money to afford the healthcare, or you might not have a good enough job that they actually throw in insurance as a benefit. So healthcare is one form of social control, but again, social control is built into the entire bureaucracy of the healthcare system in that there's oversight with pretty much everything that's going on. We want some forms of social control because we need the oversight, if only to avoid things like corruption, bad quality care, other dangerous, unethical factors. But there are formal and informal rules that manage the healthcare system. Therefore, it's not completely an independent system. It is managed by the bureaucracy, and in the bureaucracy, you have some forms of social control, which again was that government mandate, for example, that if you don't have insurance, then they tax you, for example. So those that didn't have insurance, 10 years ago, they would tax them for not having insurance. But again, is it improving lives? And one of the best ways to look at it is just through the infant mortality rate. Okay, so you can see that the infant mortality rate has been decreasing over time. However, in countries that don't have as formal of a healthcare system, you tend to see higher infant mortality rates. Okay, the US does not have the best infant mortality rate. However, it's better than a lot of other places in the world, which just goes to show you that your status as an American is associated with whether or not you can have access to healthcare and good healthcare, for example. Okay. So the trends, the book does a really good job of kind of covering when medicine become much more formal. It started working a lot better. We started seeing a lot of improvements, and the bureaucracy started to grow. Okay, so definitely look through these in your book. But again, you got polio, rubella, starting to get our vaccinations, our surgical methods started to improve. Our medicine knowledge started to improve. Our ability to test things started to improve. Our ability to study genetics and see how that's associated with disease started to improve. Our ability to track diseases and find ways to stop the ones that used to be major killers, that's helped too. And so definitely look over this. This is all from your book, so please look this over. Just kind of give you a good history of medicine, how it's improved over time, how the bureaucracy has improved over the time, how the healthcare system has expanded over time, and some really good stuff there. Thank you so much, and please email with any questions.